Today we're tackling a life or death topic: stroke. The brain attack that can strike without warning. A stroke happens when blood flow to part of your brain is blocked or a vessel bursts, starving brain cells of oxygen. The key to survival? Recognizing the warning signs and acting fast. In this video, you'll learn the 8 symptoms you must never ignore, plus how to lower your risk. Strokes come in 2 main types: ischemic, from a clot, and hemorrhagic, from bleeding. Both are emergencies, but the warning signs often overlap. Some symptoms are obvious, others are subtle. Knowing both could save a life. Let's dive into the signs you need to watch for. High blood pressure is called the silent killer for a reason. It often develops slowly without any obvious symptoms, quietly putting your health at risk. Over time, it can quietly damage your arteries for years, causing them to become stiff and narrow, which makes it harder for blood to flow. You might feel perfectly fine, but if your blood pressure is consistently above 140/90ths, your risk of having a stroke skyrockets, sometimes without any warning at all. High pressure weakens artery walls, making them prone to clots or ruptures. These are the main triggers for both major types of stroke: ischemic and hemorrhagic. Don't assume you're safe just because you feel okay. High blood pressure can affect anyone, regardless of how healthy or active you seem. Even a single, unusually high reading is a red flag. It's your body's way of warning you that something isn't right. That's why it's so important to regularly check your blood pressure at home or with your doctor, even if you feel fine. If it's high, don't ignore it or blame stress. Get it checked out. Early action can make all the difference. Sudden spikes, called hypertensive crises, can signal an imminent stroke. Sometimes you'll notice a severe headache or anxiety, but often there are no symptoms at all, making it even more dangerous. Treating high blood pressure is the most effective way to prevent a stroke. It's a lifelong commitment to your health. This means sticking to your prescribed medication, even if you feel fine or your numbers improve. It also means eating well, choosing foods low in salt and rich in nutrients, and making exercise a regular part of your routine. And don't forget to monitor your numbers, keeping a record to share with your healthcare provider. Think of high blood pressure as your body's smoke alarm. Don't wait for a fire to act. Early intervention saves lives. Ignoring it is gambling with your brain's future, risking your independence and quality of life. Remember, you might not get a second warning. Time is critical when it comes to stroke prevention. Take every high reading seriously, and don't hesitate to seek help if you're concerned. Prevention starts with awareness and action. Share what you learn with family and friends. They could be at risk too. Don't wait for other symptoms. By then, it could be too late to prevent serious damage. Know your numbers and protect your brain. Make blood pressure checks a regular habit. High blood pressure is the foundation of stroke risk. Address it now and give yourself the best chance for a healthy future. Not all headaches are created equal. A sudden severe headache, often called a thunderclap headache, can signal a hemorrhagic stroke. If you experience the worst headache of your life, call 911 immediately. Don't wait to see if it passes. Time is brain. Also, watch for headaches that are new, different, or don't respond to usual painkillers. If a headache comes with blurred vision, dizziness, confusion, or weakness, it's even more urgent. These symptoms mean your brain is in distress, not just in pain. Even ischemic strokes can cause headaches, though usually less severe. Any sudden change in headache pattern deserves medical attention. Don't dismiss a strange headache or mask it with painkillers. Trust your instincts. If it feels wrong, get checked. It's better to be safe than risk permanent damage. Headaches can be your brain's emergency broadcast. Don't ignore the alarm. When in doubt, check it out. Fast action can make all the difference. Sudden numbness or weakness on one side of your body is a classic sign of a stroke, and it should never be ignored. This symptom can come on quickly and may feel strange or alarming, even if it seems mild at first. It can affect your face, arm, or leg, often all on the same side. You might notice your smile looks uneven or that one leg feels heavy and hard to move. Try to smile or raise both arms. If one side droops or drifts, that's a red flag. These simple tests can reveal weakness you might not have noticed otherwise. This happens because each hemisphere of your brain controls the opposite side of your body. So a problem in the left brain can cause right-sided symptoms, and vice versa. Sometimes the weakness is brief and goes away. This is called a TIA or mini stroke. Even if you feel better quickly, it's still a serious warning sign. Don't ignore it. A TIA is a major warning that a bigger, more dangerous stroke could be coming soon. It's your body's way of telling you to get help now. Even mild or short-lived symptoms need emergency care. Getting checked right away can make all the difference. Subtle signs like sudden clumsiness or a pins and needles sensation matter too. These can be easy to overlook, but they're just as important. If you suddenly fumble with keys or can't grip a cup, take it seriously. Everyday tasks can become difficult in an instant. Don't wait for symptoms to worsen or hope they'll just go away. Time is critical. Every minute counts. Call 911 right away. The sooner you get help, the better your chances of recovery. Acting fast can prevent permanent damage and even save your life. One-sided weakness is your body's urgent SOS, a clear message that something is seriously wrong. Don't brush it off, even if it goes away. Ignoring these signs can have life-changing consequences. Treat every episode as a medical emergency. Quick action can mean the difference between a full recovery and lasting disability. Your quick response could save your future, your independence, and even your life. Don't hesitate. Get help immediately. Trouble speaking or understanding speech is another major warning sign of a stroke, and it can happen very suddenly, without any warning at all. You might know exactly what you want to say, but can't get the words out, or your words come out slurred, jumbled, or completely mixed up. It can feel like your mouth just won't cooperate, no matter how hard you try. Sometimes you may find you can't understand what others are saying. It all sounds like nonsense, or as if people are speaking a foreign language. Ask the person to repeat a simple phrase like, "The sky is blue." If they can't repeat it clearly, or if their response doesn't make sense, it's a red flag for stroke. Slurred speech or sounding drunk without having had any alcohol is also a classic warning sign that should never be ignored. Don't assume someone is just tired, confused, or stressed. These symptoms could be the first sign of a stroke and not just a momentary lapse. These symptoms can be brief, as with a TIA or mini-stroke, or they may last longer and become more severe over time. Either way, they demand immediate action. Don't wait to see if things get better on their own. If you notice sudden speech problems in yourself or someone else, call 911 right away. Don't wait or hope it will improve. Quick recognition and response are absolutely critical to prevent permanent damage. Communication breakdown means the brain's language center is in trouble. Don't get frustrated or embarrassed, get help immediately. Even a short episode of speech difficulty is a serious sign that should never be ignored. Speech issues are never normal when they come on suddenly, especially if they're severe or out of character. Test, observe, and act fast. Don't hesitate to seek emergency care. Your quick response could prevent lifelong disability or even save a life. Don't delay. Every second truly matters when it comes to stroke. Sudden loss of balance or coordination can signal a stroke, especially in the cerebellum. You might feel dizzy, unsteady, or unable to walk straight, like you're on a rocking boat. This isn't just a dizzy spell, it's a dramatic, sudden change. You may need to hold on to walls or furniture or feel intense vertigo and nausea. Stroke-related balance problems often come with other symptoms like headache or vision changes. Try the finger-to-nose test. If you can't do it smoothly, that's a warning. Don't assume it's an inner ear issue if the onset is sudden and severe. A cerebellar stroke can quickly become life-threatening. If you or someone else suddenly can't walk straight, call 911 immediately. Don't wait for it to pass. Balance is your brain's coordination center. When it fails, act fast. Even if it's the only symptom, it's an emergency. Time is critical for survival and recovery. Sudden, overwhelming fatigue can be an early stroke warning, especially in women. This isn't normal tiredness, it's a crushing exhaustion that hits out of nowhere. You might feel too weak to stand or climb stairs even if you were fine yesterday. Stroke-related fatigue is sudden and severe, not gradual. It can be easy to dismiss as stress or aging, but don't ignore it if it's out of character. Check for other symptoms. Can you smile, raise your arms, or speak clearly? If fatigue comes with any other stroke sign, call 911 immediately. Even alone, if it's sudden and intense, get checked by a doctor. Don't normalize or excuse this kind of exhaustion. Your body may be warning you of a brewing crisis. Listen to your body's signals. Early action can prevent disaster. Don't let this subtle sign slip by. Stroke can cause sudden clumsiness or loss of fine motor skills. Tasks like buttoning a shirt, typing, or writing may suddenly become difficult. Compare both hands. If one is slower or less coordinated, that's a warning. Don't blame it on cold hands or distraction if it's a sudden change. Even mild, one-sided clumsiness can signal a small stroke or TIA. These subtle glitches are your brain's distress signals. Don't ignore sudden trouble with everyday movements. Use side-by-side tests to spot differences. Check for other stroke symptoms. If you notice a sudden loss of coordination, seek help immediately. Early recognition can prevent a major event. Take every new motor problem seriously. Sudden vision changes are a major stroke warning. This could be blurring, double vision, or losing part of your visual field, like a curtain dropping over one side. It's not gradual like needing new glasses. It's abrupt and dramatic. Try the finger wiggle test in your peripheral vision. If you can't see on one side, that's a red flag. Complete loss of vision in one eye can mean a clot in the artery to the retina, a true emergency. Visual changes may be the only symptom or occur with others like dizziness or headache. Never wait to see if your vision clears up. Don't book an eye appointment, go to the ER immediately. The brain's visual center is in trouble and needs urgent help. Sudden vision loss is never normal. Fast action can save your sight and your life. Treat every abrupt visual change as an emergency. Recognizing stroke signs is vital, but prevention is even better. Here are 9 quick tips. Lower salt, control blood sugar, don't smoke, manage cholesterol, exercise, maintain a healthy weight, get enough sleep, monitor blood pressure, and check for heart rhythm problems. Small, consistent changes add up to big protection. Take charge of your health. Your brain will thank you. Share this knowledge. It could save a life. If you found this helpful, like, comment, and subscribe for more health tips. Stay safe, stay informed. See you in the next video.